Welcome back to Tales of Truth, where we tell the truth about veterinary medicine. I'm Dr. Angie, and this is my co-host and veterinary nurse extraordinaire, JoJo. And we are going to be talking about dog vaccines.
All right. We did
And there's
cat
so much to say.
vaccines. I think, was that our first episode? One of our very first.
You know what? I don't even remember doing the vaccine episode for cats. Did we do it?
We did a vaccine sarcoma for cats. So I think
Oh,
we covered a bit in there.
oh, we did. Okay, yeah, I do remember
Yeah.
the vaccine sarcomas.
Yes.
So now we're going to talk about dog vaccines. I'm going to try to keep it as high level as possible because this is a conversation I have in the exam room multiple times a day, every day, in various forms because people need this information, in very different formats with
Right. So
different
you know
filters.
what? Can we just launch into puppyhood? Because
Let's
I
do
thought
it.
of something that we saw so many times that I never heard in conversation before working with you. And
Okay.
okay, so let's start there.
What's it going to
You're
be?
like, oh, what's coming?
I know.
No, it's fantastic information. So many times puppies would come to us and they would be due for their second or third round of their puppy series. But when we would look at their records, we would find out they were actually vaccinated before like 4 weeks, 5 weeks, something early.
Oh, yeah. Yeah. I hate it when
And
breeders
so
do
you
this.
would
Yeah.
have a conversation around that vaccine is actually null and void.
Yes.
And so start there.
Okay, here's the scoop on puppy vaccines. Okay, so we have a puppy. Mom's antibodies are being transferred to puppy, and those antibodies slowly wear off. So they're being transferred from like her vaccines, things she's been exposed to, and it starts to wear off over time. Unfortunately, it doesn't wear off over time like uniformly and the same in every dog. And so the reason why we wait until 8 weeks is so maternal antibodies can kind of start falling, like the levels can fall, and that puppy can make their own immune response. And so when I see vaccines that have happened before 8 weeks, although if it's like 7.5, like it's gonna be fine. I just don't count it. It's like it never happened.
Mhm.
And then anything after 8 weeks definitely counts. But the reason why we keep vaccinating your puppy for parvo and distemper over and over and over again is because we want to make sure that as those antibodies are wearing off, that your dog is making their own. And so it's kind of this like critical time. They're out and about in the world. They're being exposed to stuff. Parvo and distemper, biggest threats. Distemper around here is not such a big threat. Parvovirus, still not as huge as like I have seen in Texas or other places. I don't know. Maybe even Pueblo, Colorado is a different story. We don't see a lot of it, but it is devastating. I've seen enough of it that still vaccinate. If your puppy's healthy, please vaccinate your puppy for parvovirus. It's devastating and we don't need to do it. And so what
And don't you feel
depend
like those parvo puppies have lifelong? They just, I
yeah,
feel
I
like
mean
they never thrive quite the same.
I know, I do wonder about that. I think
Yeah.
yeah, I think it probably depends, but like basically when your dog gets parvovirus, they like slough their entire intestines. Not to be gross, but I mean this is the truth. It's awful. So it makes their intestines permeable. Talk about leaky gut. It's
Uh-huh.
like the epitome of gut damage. And so yes, their gut heals, but the thing is, your dog doesn't have to get parvovirus. We can just prevent it. So let's just not do it. Let's just not do it if you can. I mean, sometimes people acquire puppies that have parvovirus, and it's not your fault. But the other thing to keep in mind is so if that vaccine is given, it is not effective for 2 weeks, 14 days. So you can't go and get your 8-week-old puppy a parvovirus and then go to PetSmart the next day or the
Right.
dog park.
Training
And
classes, puppy training classes.
not quite yet. Not quite
Yeah.
yet. At least let's give it 2 weeks. But to that end, if we're going to talk about puppies, I do some relief at different clinics and I've definitely followed around. There are a couple of veterinarians that will not let their like 12-week-old puppies out into the world until they've had their 16-week vaccine. And I hate that. I think it's terrible advice. And I think we're doing dogs a disservice because now you're in a socialization time window that's so important. Your dog needs to see other dogs, kids, bikes, skateboards, cats, cars, UPS
Uh-huh.
trucks. Like all of it needs to happen then. And so especially depending on the breed, it's more important for some breeds than others. Like please do not take your cattle dog and keep them cooped up from 12 to 16 weeks. Like if they've had a vaccine 2 weeks after their first vaccine, let's let them into the wilds, but not into like high parvo risk areas. Like we don't have to go to the dog park to be in the wild, and we don't have to go to Petco, PetSmart. No shade to Petco or PetSmart, but we just know there's a lot
Right.
of traffic. Like, please take your dog to Petco and PetSmart after this. And so I think those are the things that people get wrong about puppy vaccine.
Right. So if we start their puppy series too early, we have to start over.
Yeah, it's just kind of like that vaccine never happened. And maybe your dog has some immunity. And I know I see a lot of breeders do that, especially like in the South, and they're doing it because they're scared, and I get it. So
They
I
have
don't,
so many puppies in the home. So,
yeah,
oh,
I get
yeah.
it. It just doesn't really count for like long term.
Yeah.
Okay, so we
Okay.
have our puppies. Okay, so we're vaccinating them for parvo distemper for sure. And that vaccine is called a million different things. Some people
Right.
call it like a DAPP. Like, anyways, don't worry about
Yeah.
that. Your veterinarian is going to say parvo distemper probably. And then puppies can also start a leptospirosis
Ah,
vaccine series.
ouch.
I know. Okay. As someone who doesn't see, the last lepto case I've had, which I'm going to immediately see one because I'm saying this, knock
Yeah.
on some wood. The last one I saw was in 2014. In my little area, we don't see a lot. I think it changes even if you go up to Longmont or down to Denver. But I tend to wait for my puppies to have leptospirosis. But that is because I'm in a very privileged area that doesn't see a lot of it. So
Uh-huh.
please talk to your veterinarian in your area. That's not me making a recommendation for your dog. That's me making recommendations for the patients I'm seeing. And so you can start that, series, 12, 16 weeks, and it's just a two-shot series. But sometimes I'll wait a little bit longer, especially my little.
I know. I mean, I've heard that leptospirosis stings.
Yes, it does sting.
Yeah.
Yeah.
Um,
I see. Oh gosh, I mean, 20 years ago when I got out of school, do you remember how reactive the leptospirosis vaccine was?
yes. I
Like,
mean, disclosure, I don't vaccinate for leptospirosis because my dogs are low risk exposure,
yeah,
but and because of just how quickly it wears off. So I mean, it's always been a conversation. Leptospirosis has always been a conversation that I've had for
yeah.
my dogs, but now it's a core vaccine. So I think that's going to change the conversations.
I give more leptospirosis now than I ever have before.
Uh-huh.
And one, the vaccine's so much better. Like when I got out of school, this is going to sound terrible, but we are telling the truth about veterinary medicine. Like there were reports of dogs dropping dead after that vaccine.
It was so
And
scary. I wonder if that's why I still don't do
yeah,
it. But go ahead.
that's
Sorry
that's
to
bad
interrupt.
PR, right?
Yeah.
That's bad PR. And I think ultimately, I don't think the lepto vaccine is that great in the sense that I wish I could have a better technology. It doesn't cover all the serovars, and it only lasts for a year. And so it doesn't make it the best solution, but so serovars are strains, just to, does that
Right. And it
you
covers what about, is it about a dozen into a dozen out
yeah,
of
which I think it's
how many? I
half.
can't remember.
I
Yeah.
feel like it's half. And so the last time we had a leptospirosis outbreak in Boulder, it was in 2014. And I remember talking to the internists that were hospitalizing all these guys. We'll talk about what happens when your dog gets leptospirosis next. But I was talking to the internist and I was like, okay, how many of your hospitalized patients are vaccinated? And
Uh-huh.
he said about 30 to 40%.
Right.
And so it's like, it's not like rabies where I'm like, I'm feeling like 99.999% sure your dog's not going to get rabies or your cat's not going to get rabies. And this one doesn't carry that same assurance. But when I talk to people about whether or not we're going to do this, I do tell them if your dog gets leptospirosis, their kidneys and liver are going to fail. It is going to cost you, at least here in Boulder County, a minimum of $15,000 to get them
Uh-huh.
through it alive on the other side. And
Hmm.
so a lot of people choose that vaccine financially
To cut risk.
to cut risk.
Like it's not going to mitigate all risk, right? Because kind of like a flu vaccine in a sense where,
Yes.
where they're determining what they think the flu strain is going to look like. The vaccine that they produce is not always going to cover the strain that actually comes out or all strains of flu that come out, except it's a little more consistent than the flu vaccine.
Yeah, it's different because
Yeah.
leptospirosis isn't mutating.
Changing. Yeah.
Yeah, it's not mutating. It's just there's just different serovars. And what I tell people And other veterinarians might cringe when I say this, but because I haven't seen a lot, what I tell people to do is take in their water bowls because it's transmitted a lot, at least in this region, by raccoons in their urine.
Mm.
And raccoons like to pee in water, which is so gross. But so I tell
Right.
people, bring in your water bowls. Don't have a water bowl in your backyard. Um,
Right. And
but
if you have a hiking dog, it's usually from a water source that they have drank
I
out.
don't know, like any cases I've ever seen, it's just someone's backyard situation.
Oh,
We used to
yeah.
think, oh, we should only vaccinate the hunting dogs. And now I don't really know. And you know what? I haven't seen enough leptospirosis in my career to have any opinion. And so probably some other veterinarian. Please make a
Well,
comment
what
on
about it
this.
made it become a core vaccine? Do you know, is it
Uh,
becoming more prevalent in other regions?
maybe.
Yeah,
I
I
don't
wonder if
know,
that's what
like
it is.
when the committee met
Yeah.
and, when they decided like it should be a core vaccine, I don't know. I do trust that they had data to support
Uh-huh.
it. I don't think it was like a big pharma lobbying the panel. I don't think anything
Right.
like that was happening. And I also noticed much fewer reactions to it. It does sting for some dogs. I would say, because I give it a lot now, I mean, I would say 20% give me a look back of
Uh-huh.
like, oh, what was that? And then every once in a while, I have a dog that's been extremely sore afterwards for like 24 to 48 hours
Hmm.
at the injection site, but like it makes their whole body sore.
Like tetanus.
I wonder, yeah, like it's like wherever we give it, like they're like, I couldn't touch their shoulders for like a day
Yeah.
or two.
Oh.
But that's happened to me with distemper parvo too.
And
Small
once you start
dogs.
with lepto, you want to continue with lepto because if you miss over that year, you have to start the series again. So then you have to
Yeah.
do a double dose, like a month apart. So it's
Yes.
kind of one you want to stay on top of.
Stay on top of it. And yeah, because then we have to booster it. It
Okay.
doesn't last that long. And it's not the vaccine manufacturer's fault. It's just that the body doesn't make a lot of long-standing immunity to spirochetes, which is like a bacteria. So that's
Okay. So that was
yeah,
lepto.
that was
Still in
lepto.
puppies. So other puppy vaccine, Bordetella.
I never care about this vaccine. You know who cares about this vaccine are boarding kennels,
Yep.
which makes sense. But I never see a puppy and think, "Oh, we got to get that Bordetella vaccine in," which is a kennel cough. And kennel cough is a bunch of viruses of bacteria that cause coughing. It's kind of like calling something the common cold. Like, I'm going to go
Uh-huh.
get my cold vaccine. And we are vaccinating for a particular strain of bacteria. And maybe there's like a parainfluenza or, maybe there's some other things in there. But it's not going to stop your dog from getting kennel cough. It might lessen it. And in group settings, we know it's good to do. So it's not that I think
Right. It's
boarding,
disease control, really
it's
is.
disease control. Yeah,
Hmm.
you're not kind of doing it for your individual dog as much as just keeping down any outbreak. And I really encourage people whenever you can to get the oral Bordetella, just because it works better. So you're getting the immune response at the back of the throat where you want it, like the tonsils and all the immune tissue back there. So we know it works better and it lasts longer. Although some dogs you can't do that, like if you have to muzzle them. Although
Yeah.
we've taught so many people to give their own dogs their Bordetella vaccine. It's one you can give your own dog.
What options are there? Is there still a nasal?
There's still an intranasal one, which I
Yeah.
hate that one. Why are we still using that? Because basically you're tilting the dog's nose up and then
Yeah.
you're dropping drops in their nose, and they do not appreciate this. No one wants to give this
It's
vaccine.
hard on everybody to do that vaccine.
Yeah, the
The oral
oral
one
one
was so much
takes.
easier. It's just hard to draw up. They made it not
Oh,
simple.
it's still that bad. It's still that bad. I
Yeah.
hate the container that thing
The
comes in, and
container,
I mess it
I've
up.
cut myself on that container a few times too. That like,
Yes,
ugh, yeah.
peeling that off.
Anyhow,
Yeah,
that's
still a
nobody
nightmare.
else has to worry about that. That's
Yeah,
just our,
totally.
you will never know. We'll never let you know that that's really happening.
Totally. We don't know. It's
Okay,
behind
so
the scenes.
Bordetella.
More to
And
tell.
they're probably not going to let you bring your dog to the groomer, to puppy daycare. And some are going to require it every 6 months, and some are going to be every year. Same
Which
vaccine.
irritates me.
Yeah,
Irritates me because
it's
it's
good for more than a year, actually.
well, is
When
it
they did the
really?
studies, yeah, I think it was closer to 18 months, but don't quote me on that, please.
Okay. I didn't
But
know that.
I believe, like, we know that it definitely goes to a year.
I know. I hate it when boarding kennels are like, no, you have to give that every 6 months. And part of me's like, don't tell me what to do.
Yeah,
Don't tell me what
they
to
do.
do.
Yeah.
But then I do it. So because I want my
Right,
dog
because
to.
yeah, they have to. So, And, my groomer asked for the lepto proof,
Oh,
not as a
snap.
core vaccine. And I was like, "Oh, no."
Oh, no. Okay.
Like, I don't wanna do that to my 12-year-old dog
Yeah.
who's just
Well,
really not getting exposed. Okay, but
yeah.
puppies still. So now
Pup.
we've gone through Bordetella. Then the other controversial time frame is for rabies.
Oh, yeah. I know.
People tend to vaccinate pretty early.
I know. It used to be like, I think it was 16 weeks and then it moved to
Mhm.
12 weeks. Jean Dodd, if you go to like the more integrative side, she's like 6 months. And I'm so privileged to work in the practice I work in because every puppy has their own tailor-made,
Vaccine
different.
protocol.
Oh yeah, like
Yeah,
it's yeah.
I
So
love that.
I give it when it seems like the right time to give it based off of the time of year. If I have a 12-week-old puppy and they're like, we want to go camping next week,
Mhm.
yep, that we're doing that because we do have rabies around here. And so, but if they're like, if it's February and they're 4 months like or 3 months old, I'm not gonna do it at 12 weeks. I'm
And
gonna
it's the
wait.
Italian Greyhound that's gonna live in the apartment and
Right,
its
exactly.
little sweater.
Although the last two rabies cases in Boulder have been in bad.
Mm,
So,
yeah.
anyways, not to add more fear, but I do it when it seems like the right time to do it, which sounds probably like witchcraft, but it's more about like do some people want to spread out the vaccine, some people want to do them all at the same time. Some dogs are little, some dogs are big. Like it really depends on the situation. And so that's why I don't have like I always do rabies at this time.
Can we talk about something that was asked of us this week around rabies vaccines?
Yes. Let's talk
Okay.
about it.
Okay. So,
And it's good.
and
It's good.
I do. I love when people are advocating for what they feel is best for their animal. Someone reached out and had a veterinarian on the West Coast who was giving their dogs a titrated or a smaller amount of rabies vaccine based on their weight. And I have so many questions around that because one, I wonder how is that from a law standpoint, like so much of why we give rabies is because it is required by law. How are they getting around that without a full dose of a rabies vaccine? And how do we know that it is as effective? I mean, I have so many questions around that. You probably know all my questions, just answer them.
Yeah, I'll talk about this. I spent a lot of time talking about this.
Yeah.
And it's tricky because vaccines aren't dosed like drugs because they don't work like drugs. So we're just stimulating the immune system. And so let's like start the conversation with that. But also, I think it's so reasonable that people are like, wait a minute, my 2 pound Chihuahua is going to get the same dose of rabies as my 120-pound Great Dane.
Yeah,
Like,
fantastic curiosity and thinking skills.
yeah,
Definitely.
and
Yeah.
I'm going to admit, as I pull my cat off of my desk one more time, I'm going to admit that there's some holes in our data.
Uh-huh.
And the reason why there are holes in the data is because so we study rabies vaccines on beagles. If we did all these other studies on different sizes, different breeds, there would be a lot of loss of life. And so just we're telling the truth. This isn't a soft or a lovely truth. But when we test rabies vaccines, we give animals the vaccine and some animals don't get the vaccine and then we challenge them with the disease.
Oh yeah, so it's a death penalty.
Yes, this is not a time where the pharmaceutical industry is trying to scam you. This is ethics of what do we find acceptable. And so I think that it makes sense why people are like, I don't want my 2 pound Chihuahua getting the same dose, but it doesn't necessarily mean that they're going to have a different reaction, if that makes sense. Like, let's say you're like, okay, well, I'm going to give my 2 pound Chihuahua a quarter of a cc. Most of these vaccines are 1 ml or 1 cc. So it's like, I can understand why you think I'm going to give my Chihuahua a quarter of the dose, but it just doesn't work like that because it's not a drug. And we don't know that that's actually going to stimulate the immune system enough.
Like it's
Just
enough
like,
to stimulate. You
right.
mean, yeah, immune
Yeah.
response.
And just like a Great Dane, we're not going to give them 2 cc's.
Mm-hmm.
And so I understand people's concern, but what I do is if I have small dogs that react to vaccines poorly, I'll use titer tests or we'll use a different schedule. And so I think that's really where we get into trouble, is that small dogs do have more vaccine reactions. And
Mm,
I don't think the answer is giving them less of a vaccine dose.
right.
I think there's
It's to maybe, so what you feel the answer is to then test titers and shift their protocol or shift their schedule of their vaccines. Well, I mean, if
yes,
it depends on how bad the reaction is, right? That's going to shift it
exactly.
completely. Yeah.
Yes, yes. And so I think then we need to really get into their individual protocol. What happened? What was their reaction? Because if they did fine with their rabies vaccine, they're probably always going to do fine with the rabies vaccine. I mean, this isn't always the case, but there's no need to change
Hmm.
change what we're doing
Okay.
just because they're little.
So rabies vaccines, let's clear that out and close that out. Those after the first year are given every 3 years typically.
At least in Colorado, I know maybe some other states
Oh,
have
it could be
different.
different. Yeah,
Yeah.
that
And
is true.
really in Colorado, it's not mandated by the state. Everyone's like, this is required by the state. No, it's not. It's actually required by the county.
The county. Yeah.
Yeah. And here, everyone kind of follows the every 3 year rules that is industry standard.
Hmm.
That might be different in different states.
Okay. So a puppy has gotten through their series around 6 months of age on
Mhm.
average. So then
Yeah.
we're looking at every year to 3 years, depending on the vaccination or the
Yeah. So,
vaccine.
yeah, if your puppy got their rabies vaccine between 4 and 6 months, then they're going to be due in 1 year. And then after that, every 3 years.
Yeah. And then we have vaccines that are being offered more is the influenza vaccine.
Yes. I actually give this one sometimes because there is a local boarding facility that's a veterinary clinic in Boulder that requires it. And I don't use this one because I just don't see canine influenza around here. I know we had that weird outbreak
Yeah, there was an outbreak, but
like 3 or 4 years ago.
yeah.
And
Again,
it
is
was,
this more disease control? I mean, like community, like keeping community
I
pretty
don't
clear of
know.
disease, or is it a really hard disease to have?
Well, whatever was going on, and I don't know that we ever confirmed it was canine influenza. It
Uh-huh.
was really bad,
Uh,
but then it kind of went away, and I don't know. No one ever said it was canine influenza. So why I'm vaccinating for canine influenza, I don't know. I don't necessarily agree with that protocol to do canine influenza right now, but I'm
so
happy
maybe
to.
during times of outbreak, it might become. I don't know.
Yeah,
I can tell you, I've been to other clinics and it's never been offered to me.
no, yeah. So we just literally have it for people that are boarding there. It's the only reason why
Okay.
we carry it in the clinic. Yeah.
Okay. And maybe again in other parts of the country, this is more standard of care than it is here.
Yeah, I think
And
so.
same with the Lyme vaccine. I think in my whole career, I've given two of those.
Yeah, I've never given one. Not that I remember anyways. We don't
Yeah,
have it here.
I think we did order it for one client
Oh, did we? You're like,
that was going to
"Actually,
be
Angie,
traveling. Yeah, because I
you
remember
did
'cause it
give it,
was
and it was with
very, very
me."
expensive. Yeah, it was
Yeah.
really pricey.
Okay.
That's what I remember about it. But
Yeah.
I would assume in the Northeast, again, with all your ticks and Lyme,
Yeah.
this is standard of care.
Would be my guess.
Yeah. And if we had ticks and Lyme here, probably one I would consider.
Totally. Lyme's disease sucks.
Yeah.
No one wants it.
Yeah.
And I don't know because I don't use that vaccine. I don't know how well it works.
Yeah, I don't know. I don't know anything about it. That is so interesting to have parts of veterinary medicine that we just don't experience at all.
Can't keep up with it all.
Yeah.
And so I actually, the last couple weeks, have practiced the rattlesnake vaccine has come up.
Oh yeah, I forgot about that.
So we
Yeah.
carry it in the clinic.
Uh-huh.
And I have a couple people that do it, and I'm always like, this is like not going to maybe change anything. And they're like, I know, but I don't care
Yeah.
because I have rattlesnakes all over my property. And they're
We've
like,
had so many this year. And right now is breeding season, so it's so bad.
ugh, ugh.
I pulled a baby rattler out of my office
I'm
like
so
what,
sorry.
earlier this week, last week? Yeah.
Yeah. And I really like snakes, but rattlesnakes scare me. Yeah, I
Yeah.
don't like that. But would you give your dogs the rattlesnake vaccine
No,
knowing
it's
that
not effective enough. I've
yeah,
read all the data, like they offer it, and I'm just like, but why? I feel like maybe it might buy me more time to get to the emergency clinic. Like I might just have more time and that
do we know
venom.
that's true?
No, but
We
it
don't even know
might.
that's true.
I mean, like that part of it feels
Hypothetical.
true.
Yeah. You're like, I don't know.
But no, I've never done it, and my dog has been bit by a rattlesnake in my own yard, and we do have because we back up to open space on multiple sides of our house, and we just have so many. Sage stepped on a giant one last week. on our walk, just stepped right on it,
And it
and it
didn't
was
bite her.
so mad.
But
No,
it
it
went
didn't
did it
bite
just
her, and we had a I mean, Adam and I were just panicked. So anyhow, rattlesnakes, and I have not given the vaccine.
yeah.
I
I know,
again, I
someone
feel like
asked
it's
for it.
more hype than it is
Yeah.
what's the word I'm looking for? It's more hype than
It's effective. It's not really that effective.
yeah.
Yeah. No one's doing it.
I think rattlesnake training would probably be a better option than the rattlesnake vaccine.
Right. Sounds
So,
exhausting.
yeah,
Um,
I forgot about that one. That's how
yeah.
under the radar it is for me. I'm like, "Yeah, I'm never gonna
Yeah.
do that."
Yeah, I think we covered all the vaccines.
Yeah. I
And I
wonder
think
what
we
questions we left people with, though, because I feel like
oh,
vaccines are such a huge topic.
oh my gosh. And we did a whole episode on titer testing, didn't we? Or did we just talk
Yeah.
about doing the episode? No,
Well,
we
it's
did it.
going out on Friday, yeah. So by the
Okay.
time this releases, that will have been out, so you can go back and watch our Titer episode, which is a great complement to this topic.
Yes. Yeah. Yeah. So we'd love to hear from you. And I do have a course on our website, folderholisticvet.com, where I went over vaccines. So it's a more in-depth conversation. And you can get that for free just because you're listening to this podcast using the code Truth Tales. And if you go to, I think if you navigate to learn more on our website, there's a course section and you can use that code and you can spell tails any way you want, but like
Wonderful. Yeah.
only ways that are actual words.
Right, don't
And
spell it any way you want.
that was,
It
yeah.
won't work. Tails or Tales, those are your options.
Those are your two options. And so you can get that for free. And then we'd love to hear from you. What have you hated that we've said in this? I feel like so many of the comments are just like, I hate what you said.
You don't know anything.
I know, which is fine. You can tell us that. But what questions do you have? What can we answer no
I
matter
would also
where
love
you're
to know
watching?
if you live somewhere else in the US, what vaccines are being offered to you on your annual
Yeah.
visits.
And some
Mm,
veterinarian that's listening to this that practices in a Lyme endemic area, how how well does that vaccine work?
yeah,
Someone
I
tell
would
me.
love to know.
Yeah.
Okay,
Okay. See you
take
next
care.
time. Bye.